Hi everybody, I'm sorry not to be with you in Parma. My talk is about the new 3D imaging tools to investigate the pelvic varicose veins. I have no conflict of interest. First of all, I would like to make an anatomical reminder about the pelvic and lower limb veins that constitute a functional and anatomical unit with a tight relationship between all the veins. This requires a full assessment, anatomical and hemodynamical, which is mandatory for every patient. These multiple and complex anastomosis are first parietal anastomosis, and you see here anteriorly the Santorini plexus, posteriorly the sacral plexus in orange, medially the gluteal, and inferiorly the obturator and gluteal anastomosis. There are also visceral anastomosis from left to right, and also the left ovaric vein coming from the left renal vein. This anatomical diagram is showing the main important lead points from the pelvis to the lower limbs, and you can see that the P point coming from internal pudendal, the obturator coming from obturator vein, and the gluteal veins are the most important lead points. How to investigate the pelvic veins? By color duplex, by selective phlebography, but also by CT venography, which can lead to display in virtual reality, immersive reality, which are new tools, interactive tools, due to accurate 3D model segmentation. And you see here a new program, which is IRIS. So CT venography is a very nice technique, and this paper showing the different indication and the technique of CT venography. So I would like to propose you some case reports about the lead points to the lower limbs, and the main are P perineal, O obturator, and G E gluteal P points that you can see here in this diagram. First of all, the anatomy of P points, and you can see in the drawing in the center, it's coming from the obturator vein in green, which is coming with the nerve and the artery through the Alcock canal. And you see the emerging point, which is a P point shown here. And you can see the clinical aspect and the phlebotomy aspect. This case report of a woman with varicose veins is showing an axial reflux of the great saphenous vein trunk, but this is not coming from the inguinal area, it's coming from the P point and the perineal network. Here in this case, the origin of this is a pseudo-Matthew-Nash syndrome, and you can see here the compression of the left iliac, common iliac vein and vena cava by the right common iliac artery here very nicely. The 3D reconstruction with 3D modeling is showing more in details. The O point you see here coming from the obturator hole, and the P point here. And this animation is showing more things. You see here the obturator hole and the obturator vein joining the femoral vein here in the ear. And you see very nicely also the internal pudendal vein running on the Alcock canal and the P point here on the right. So you see here the iliac, common iliac vein, left common iliac vein, and hypoglossal vein. And you see the two veins, obturator here and pudendal here, coming from the hypoglossal vein. Another example with 3D reconstruction is this case of the O point. You can see by the intern of the pelvic area, you can see the two branches feeding the obturator hole and the O point is the superior one coming from the hypogastric vein here, mark 2, and the inferior one coming from the iliac vein, mark 1. They join in the obturator vein, crossing through the obturator hole. Now the GE point is a very interesting case because it's providing a reflux and a varicose veins of the sheath of the ischiatic nerve. And this is transmitted by the axial vein. Here the case is showing the clinical presentation. It's varicosities of the calf. And if you follow the reflux, you can see that it's going deeply in the thigh. You lose it in the thigh here. And you can see what is the real anatomy. The femoral vein being here, you see that here the plexus-shaped dystrophic network is surrounding the ischiatic nerve, is coming from the inferior gluteal vein here, and this is a display of the varicose vein of the ischiatic nerve. You see, once again, we don't see directly the ischiatic nerve, but the shape of the nerve is surrounded by all this network. An animation showing the same, and you see very nicely all this dystrophic network which is surrounding the ischiatic nerve from the pelvic area to the popliteal fossa. Thank you very much for your kind attention. If you want to know more, you have my atlas book. Thank you.